Good morning, everyone, and thank you for coming. A year ago at this time, the Hold Up Squad was speaking publicly about the alarming increase in pharmacy robberies across our city. In 2021, there was a total of 49 pharmacy robberies, which jumped to 123 in 2022. This trend was continuing in 2023 until pharmacies across the city began to implement time delay safes. To provide context, pharmacy robberies were very lucrative. Each pill obtained was sold for profit, and there was an obvious demand. The public safety concerns around these robberies are significant. Criminals were often using stolen vehicles to commit these crimes, which is thereby creating a victim of auto theft. They were violently attacking pharmacists, staff, and putting the safety of customers at risk. And of course, the drugs would end up on the street, contributing to the opioid epidemic that is resulting in overdose deaths and having a traumatic and devastating effect on our communities. Apart from undertaking investigations, the Hold Up Squad, in conjunction with the Community Partnership and Engagement Unit, began to consult with pharmacies to determine what their needs were and to conduct crime prevention through environmental design. We took part in town hall meetings and presentations for the pharmacies to establish a collaborative working group with external partner agencies, including the Ontario College of Pharmacists, the Ontario Pharmacists Association, in an effort to spread awareness and safety tips to reduce the incidence of robberies and victimization. This included recommending that pharmacies invest in good surveillance cameras, panic alarms, and of course, time delay safes, and making sure those safes stay locked at all times. Time delay safes have proven very effective at deterring robberies at pharmacies in other jurisdictions, such as Western Canada, where the number of instances have been drastically reduced. We anticipated that they would have the same impact in Toronto, and they have. In 2023, pharmacies in Toronto decreased by 23% compared to 2022. Year-to-date pharmacy robberies are down 82% compared to the same period in 2023. This success speaks to the impact of time-delayed safes, but also demonstrates the importance of collaboration among stakeholders to address issues that impact the safety and well-being of our communities. Whether it be pharmacy robberies, carjackings, auto theft, or retail robberies, working together with our residents and our law enforcement and industry partners, we can make it harder for criminals to victimize our communities and ultimately make a safer and more secure Toronto for everyone. Now I'd like to ask Peel Regional Police Deputy Chief Mark Dapat to say a few words. Thank you.
Thank you, Inspector, and good morning, everyone. Thank you for joining us today. As the co-chair of the Ontario Association of Chiefs of Police Community Safety and Crime Prevention Committee, I'm pleased to speak on behalf of my co-chair, Director Barry Horban of Windsor Police Service, and the entire committee membership represented by police services across the province, some of which have joined us today. I'm pleased to join the Ontario College of Pharmacists and our partners in law enforcement to share the positive impact of an innovative approach to enhancing security and safety for Ontario pharmacies through the adoption of time-delayed safes. We are in an era where we are facing challenges with both an opioid crisis and pharmacy robberies. These have become prevalent issues for our communities, and we must find solutions to address them to ensure everyone's safety and well-being. Time-delayed safes are designed to open only after a predetermined delay, making immediate access to controlled substances more difficult. This feature significantly diminishes the appeal of pharmacies as targets for criminals looking for quick theft opportunities. Time-delayed safes enhance the safety and peace of mind of pharmacy staff and their customers. Pharmacy workers are on the front line, often facing the direct threat of violence in robbery situations, knowing that high-value medications are securely locked away and inaccessible to alleviate anxiety, allowing them to focus on providing care to their clients rather than the traumatic confrontations. For customers, pharmacies can continue to be safe environments where the community can access the health and well-being resources they need and depend on. We are also seeing positive trends, such as a decrease in robbery incidents in pharmacies equipped with these time-delayed safes. As police services, we are always looking for opportunities and strategies to improve public safety and decrease the likelihood of crime. And this is an excellent example of how this can be done. In Peel Region alone, we've observed a significant decrease in pharmacy robberies since the implementation of time-delayed safes. It's also a demonstration of the impact of when law enforcement, stakeholders, and the community work together to identify solutions to improve safety for everyone. By reducing the number of robberies and break-ins, we are protecting our healthcare providers and their patients and allowing police to allocate their resources to other pressing community safety priorities. Finally, and unfortunately, our police officers are on the front line of the opioid crisis. We've seen the devastating impact on families and communities across Ontario when lives are taken by overdose and drug abuse. Through enhancing the security of narcotics and other controlled substances, helps to better regulate the distribution of potentially addictive medications and restricting access to those who've been prescribed these types of medications by the appropriate healthcare providers, which can limit prescription drug abuse. I would like to thank the Ontario College of Pharmacists, all the pharmacists and their staff across this province for their vital role that they play in our community's well-being. And to our police professionals and partners, thank you for your role in making Ontario safe every day. And now, I would like to ask James Morrison, the chair of the Ontario College of Pharmacists, to say a few words.
Good morning. My name is James Morrison. I am the board chair of the Ontario College of Pharmacists. We are Canada's largest pharmacy regulator, overseeing Ontario's 25,000 pharmacists and pharmacy technicians in nearly 5,000 community pharmacies and hundreds of hospital pharmacies. We are here today to announce an important milestone in the prevention of pharmacy robberies. Every community pharmacy in Ontario, all 4,900 of them, in every corner of the province, is now reporting the use of time-delayed safes for the storage of narcotics. As a pharmacist, I know many who have experienced the trauma of a pharmacy robbery firsthand. They can cause emotional and physical harm to those who experience them and witness them, and cause societal harms as a result of stolen drugs making their way into local communities. Over the past few years, the college has been partnering with the Ontario Association of Chiefs of Police to help, and other law enforcement partners, on an array of activities to help pharmacies prevent robbery and thefts of narcotics and how to respond to them if they ever experience a robbery. During this work, we monitored the actions taken by other provinces that were also looking at ways to prevent robbery of narcotics from community pharmacies. One of those strategies increasingly adopted was the universal use of time-delayed safes in pharmacies and signage indicating their use. We know from our law enforcement partners and those who target pharmacies rely on speed to enter, to acquire stored narcotics, and exit quickly. By requiring narcotics to be stored in time-delayed safes that could only be opened after a minimum amount of time has elapsed, it denies perpetrators of the ability to get in and out of pharmacies quickly with stolen narcotics. It deters pharmacy robberies from happening in the first place. Especially when all pharmacies are using time-delayed safes, and when people know about their use. British Columbia and Alberta were the first two to implement these mandates, and together, with increasing public awareness of the use of safes in pharmacies, demonstrated that a province-wide time-delayed safes mandate was an effective robbery deterrent. For example, in the 6 months after the implementation of the mandate, the City of Edmonton saw 0 pharmacy robberies. When media reports began to show a spike in pharmacy robberies in the latter half of 2022 and early 2023 here in Ontario, the college acted decisively to implement a similar mandate here. In March 2023, the OCP board approved a province-wide time-delayed safes mandate for all 4,900 community pharmacies, with the unequivocal support of the OACP, local police forces, and pharmacy partners, including the Ontario Pharmacists Association. Today, we are celebrating the full implementation of this throughout the province. This success is partially dependent on the public awareness of the use of safes. Time-delayed safes are an effective deterrent, and we are seeing other provinces, most recently Saskatchewan and Manitoba, adopt a similar mandate. But perpetrators must be aware that they are in use. I want to be very clear. The more people who are aware of the use of these safes, the greater chances we can get this message to reach the eyes and ears of perpetrators, that pharmacies everywhere are now using time-delayed safes to secure all narcotics and are required to do so without exception, that there is no way to bypass the time-delayed requirement. Ontarians in every community will begin to see their local pharmacies equipped with these signs. There's a big example next to me here. These signs will appear at the entrance of the pharmacy and at the dispensary. Now that pharmacies have reported a safe installed, it will take only a matter of weeks before all pharmacies will be displaying this signage. This has been a substantial undertaking, yet it is an example of all pharmacies working together to protect the safety and well-being of pharmacies, their staff, and communities everywhere. We are proud to have worked so closely with the OACP on this initiative and our law enforcement partners that are building stronger relationships with local pharmacies across the province. And we are immensely thankful to the pharmacies, pharmacists, and pharmacy technicians everywhere for their commitment to working with us to achieve today's milestone. Pharmacies are playing important roles within an ever-evolving healthcare system, and they are and will continue to be safe places for pharmacy professionals to deliver great care that Ontarians have come to know and trust. Thank you for being here with us today.
Okay, our speakers will now take any questions.
I have a question for James. You talked a lot about the fact that making sure that the potential thieves know that these time-delayed safes are in the pharmacies. If they don't know that they're there, does that potentially open the door for more violence against those pharmacies and the workers? Because if they want the narcotics and they can't get it, and when the employees are saying we have these time-delayed safes, and they don't know that or they don't understand that, that can lead to more violence.
Thank you for the question. What we've seen, and we carefully considered this question, but what we've seen in other provinces, Alberta and British Columbia, with a similar mandate, we didn't experience additional violence, for example, in pharmacies from what we've seen in those provinces.
And then in terms of, you said all 4,900 pharmacies in Ontario, they're now using it on a consistent basis, and what's going to be the checks and balances system here if there is any inconvenience for them in terms of doing their day-to-day work?
The college has been very clear with pharmacy operators that it is a mandatory requirement to implement time-delayed safes. Should there be rare occurrences where that's not being followed, that would be considered misconduct. The college is conducting, spot checks now, but also observing time-delayed safes during routine audits on pharmacies. So we will get to any pharmacies that are not complying, but that doesn't appear to be an issue at this time.
Perhaps both Deputy Chief and Inspector can answer this one. From a policing perspective, obviously less violence is good against pharmacists and members in that community, but how is that translated to your broader communities at large? Are you seeing less fentanyl, less these narcotics out there proliferated in your community?
That's an excellent question, and I'd have to check with our drug squad on that one. What I can say is that the pharmacy robberies for this year we've gone down to 10. So year to date, this point last year, we were at 60. So if those drugs are getting out onto the street, they're not coming from the pharmacies, certainly at this point.
Deputy Chief, maybe in Peel, have you noticed a marked difference when it comes to these illegal substances out on the street?
Similar to the inspector's answer, I'd have to get the answers from our drug squads. But what we do know is that when we partner with community, when we partner with associations like the Ontario College of Pharmacists and implement crime prevention measures, we assess them at a regular basis to make sure that it's effective. And what we're seeing right now is specifically when it comes to pharmacy robberies, that there is a reduction, and we're hoping that that translates to exactly what's happening on the road.
Are there any reports of like a crime in progress and then they realize there's these safes and they're told that they can't open the safe and so they just leave? Like, has that actually happened yet?
I can comment that, yes, that has happened. Criminals are after an easy target, and once they find out that these pharmacies have time delay safes, they go off and they go to an easier target. So there hasn't been, we haven't experienced that level of violence, and they simply move on to an easier target.
Any other questions?
Can I ask you, what's a typical day like for a pharmacist? Let's say I go in for my prescription, they say I come back at 1 o'clock, that kind of thing. So those pills would be taken out at a certain point, but this is not just an overnight closure of like a bank, for instance, I suppose, but is the safe open and closed many times during the days that they do?
Thank you. So the way pharmacies operate is they're filling prescriptions on demand throughout the day. So as a request for a controlled substance, a narcotic that's kept in the safe, is being demanded to be filled pursuant to a prescription, the pharmacist or would then enter a code onto the safe, and they would wait a period of time for it to open. They would retrieve the medication they needed to fill that prescription, close the safe, and then when they need to return that stock back to the safe, they would open it again. So safes are not to be left open. They are only opened to retrieve or return a narcotic into the safe.
James, from a human perspective, I mean, obviously this leads to more drugs on the street and there's the violent aspect of it. But can you add some humanity as to what these pharmacists have been experiencing? And I'm sure there has been fear just over the last few years, knowing that they could possibly become the target of these criminals.
I can tell you my own personal experience. So I outside of being chair of the board, I oversee pharmacy operations for about 200 pharmacies in Ontario. And what led us to implement this mandate was hearing from my colleagues and my peers facing robberies in their pharmacies that were persistent, and we heard the data. There was a high degree of robberies prior to this mandate. It has lasting impact on not just the pharmacists, but the staff that work there. They become fearful to come to work when they don't know when the next robbery might occur. That's why I'm so grateful for where we are today and the support we've received from the police services to hit this milestone. It means a lot. I can tell my teams that they don't need to be fearful to go to work anymore, and that robberies are far fewer. It was a huge problem.
Was there tremendous pressure, I guess, to do something to address the problem?
I think the pressure came from the college internally. No one told us to do this, but we were looking at the risk of harm to the public and to the professionals working in those pharmacies. And we looked to other jurisdictions to see what may have worked. We looked to the police force to learn what they recommend. And it was clear that time-delayed safes is one key aspect that could really help turn the tide on pharmacy robberies.
I have a question. Is there a standard for the timing for the delay? 'Cause you said they punch in the code, they have to wait a certain amount of time. Is there a standard for you guys on how long it should be?
Thank you. There is a standard regarding the minimum amount of time for a time delay. It has to be at least 5 minutes. However, individual pharmacies will set whether it's 5 minutes or more. It's up to them.
Just out of curiosity, go ahead.
I just want to make sure, just so that, because I know there's a lot of curiosity about this specific issue. Some of the questions that are asked, if it's about the time when it comes to safes, it would be beneficial for everybody to not speak about it, because what we're trying to do is curb the fact that people are going to strategize and commit robberies at pharmacies. The last thing we want to do is release any information that tells them exactly how the safes work. And I know there's a lot of curiosity, but back to your point, Beatrice, when it comes to the Ontario College of Pharmacists and when they approached our Community Safety and Crime Prevention Committee, much of the conversation surrounded not just the impact on the pharmacists, the business owners. When we weighed the value of this, it made perfect sense to us that we were responsible as police services to look after the safety and well-being of not just the residents of our jurisdictions, but also look after the people that work there, that live there, and visit there, and the customers that go into these places. So when we took all that into consideration, it made perfect sense for us to look into this initiative, see the successes that's been happening in other jurisdictions across the country, and applying it here.
What's the message to the general public, just in the sense that obviously this is a new system, and even though there is going to be some sort of delay on a day-to-day basis, do they need to practice more patience? What do they need to know when they come to have their prescription filled?
My view is this really shouldn't impact patients. There's a number of process steps in filling a prescription for safety and accuracy, and this is just, one extra code a pharmacist has to put, but in the overall scheme of how long it takes to fill a prescription, it really shouldn't affect patients. Of course, encouraging patients who require narcotics to phone ahead would be great to give the pharmacist a little bit more time to plan, but otherwise it really shouldn't affect patients at all.
Sorry if this was already mentioned, is there a standard time as to when the safe would open? I mean, I don't know if you want to share how long it takes for the safe to open.
I think the deputies already talked about that or briefly discussed it, and we're not going to discuss security protocols that the pharmacies have recently put in place to deter the theft, and I'll leave it at that.
The thefts that had occurred in the previous year, was it your experience that this was organized criminal activity, or simply people in distress looking to get a fix?
There's a combination of both, actually. There certainly were the organized counter-jumper style pharmacy robberies where they jumped the counter, numerous people, and there certainly was the, as you put it, the person in distress who's coming in looking to get some narcotics.
Okay. Thank you, everyone.